This is Dr. Wallace. I know this is cheesy, but I'm doing a video because I can't be with all of you in the lab, and I want to make sure everybody has heard the same thing about ostomies and about wounds, because you know they are my passion. So I'm coming to you from a lovely wound care center that shall remain nameless. And I'm going to show you a few of the ostomy products that we have, and then you should have some in your lab and you can pass them around and kind of get the feel of them. We talked in lab and in class about two different things. We talked about colostomies and we talked about ileostomies. Remember, ileostomies have liquid output, very acidic. Colostomy, depending on how far it is in the GI tract, can be pretty close to normal stool. So if you have an ileostomy, you're going to want to empty it, or if you have a patient with one, you're going to want to empty it when it's a third to a half full. So if you're looking at one of these pouches, when it's about here down, you're going to want to keep it emptied. Yes, these pouches will hold a lot more stool, but the more that's in here, it pulls on the adhesive and they will pop off. So keep that in mind. And then we change pouches out usually once or twice a week on everybody, unless they use a disposable. And you change it when it leaks, itches, or burns. And you guys should be familiar with all that. We've already been tested over it. It's all in your notes. So a couple of different kinds of pouches. Two basic kinds. There's one piece and there's two piece. Here is a one-piece pouch. This is one you would put on a colostomy that's pretty solid, solid output, one that's at least 6 weeks old, so we know what size the stoma is. And you see a one-piece is a lot more flexible. You pull the back off and it actually just sticks right on the skin. This one has a roll-up closure, so it's a nice Velcro. Everything is soft, nothing sticks to the patient. The other type is a two-piece. This is an example of a two-piece. You have what's called a wafer. That's the part that sticks to the patient. The pouch itself then snaps on. You can get a close-up. It's kind of like Tupperware, y'all. It just snaps together, and you can get your finger under here and snap it. And if you can hear it, it snaps just like that. This pouch is also different as it's beveled on the back. That's called convex. So that is for somebody who might have a little bit of a crease that we need to kind of fit down into. And you notice the two-piece pouch is not as flexible. So this is for somebody who needs a little bit more support and kind of a solid, firm surface. And it just really depends on the patient's body and their preference as to whether they go with a one-piece or a two-piece. The other thing I want to show you is a filter. Remember, these patients cannot determine when gas is coming. It's going to come when it wants to, and it will puff up the pouch, kind of like a balloon. So this filter is built into the pouch. It's charcoal. So it kills the odor and it lets the gas out slowly, so they don't have to worry about having a balloon under their clothes. So filters are a great thing. This pouch is a little bit different. This is a one-piece, this is a closed-in pouch, and this is a beige pouch. It is a closed-in because it's for a colostomy, for a patient that really only goes to the bathroom maybe once a day. They can go, have their bowel movement, take off the pouch, throw it away, stick on a new one, and not have to worry about emptying and all that. So that's great. And this is for a patient who doesn't want to see what's inside. We can keep it nice and concealed, so you don't always have to stare at it. So there's a lot of different options. The other one I want to show you is the urostomy pouch. Remember, we talked in the video or in class about how there's a spout. So this is very important. If you see the drip, the spout is open, and we always say if the drip is showing, the urine's flowing, because this means you can empty it and then you close it up when you're done. Okay, so that's your urostomy pouch. And all pouches come in one piece, two piece. Most of them you can get beige. Some of them now are gray, so you can't see it under a white shirt, which is nice. They have some that are like a dry fit material. We have wafers that have lotion built in, so it's really good for the patient's skin. Pouches used to be rubber. I had a patient that had one that looked like a black rubber tire. It smelled like a rubber tire. I tried really hard to convince him to come to the 2000s, and he loved those pouches. They worked, so that wasn't happening. But companies now spend a lot of money, do a lot of research to try to make this as manageable as they can for our patients, and that's a good thing. So there's lots and lots of options, and I always give my patients a catalog. I set them up with samples so they can try a lot of different things and see what is best. So what you guys probably want to know is how to change a pouch, right? So we have a lovely simulated stoma, and y'all have seen these in the lab. They're on a lot of our mannequins, sometimes in weird places, but an ostomy kind of looks, we talked about this, it should be budded, it should be red or pink and moist. Sometimes, however, they are flat or skin level, and that just makes it a challenge as far as getting the pouch to stay, because obviously the liquid would want to go under the edge of the pouch and not in. So if you have one that's flat, that's when you pull in that convex. Again, this will help push out that stoma into the pouch. But for this purpose, we are going to have a nice budded stoma. We're going to take that pouch off. We're going to clean that skin with a warm, wet washcloth. We're not going to use soap. We're not going to use baby wipes because that leaves a residue and makes it really hard for the pouch to stick. So that is done. Our skin is nice and clean, but I need to know how much or how big to cut the wafer of the new one I'm going to stick on. And so most of your pouches will come with a little measuring guide that's super handy. And what you don't want to do is you don't want to cut the hole so big that there's a lot of exposed skin. If you can see that, we talked about how that drainage is very acidic. You don't want to sit it on your skin. So that's too big, y'all. So that's obviously too small. It looks like that one, that's probably a little too small. So we're going to go with the 2-inch, and it leaves just about 1/4 of an inch all the way around, okay? So that's all the skin that's going to be left exposed. Then we would take this, put it on the back of the pouch. Let me find one that fits. We'll go with this one. Trace it and cut it out, and now the hole will fit around the stoma, okay? The other thing that you can use, especially on an ileostomy, is some sort of paste. And when I say paste, people think glue, but the pouches themselves are adhesive. So the paste is actually like caulk. Like if you are caulking your bathtub, you're keeping that liquid from going where you don't want it to go. So it's the same thing. So once you've cut your hole, you can either use paste from a tube like this, or sometimes you'll have a really nice paste ring that's kind of like silly putty. You can take it and you can either put it right around the stoma on the skin, or you can put it on the back of the pouch, which is what I prefer, right on the edge of the hole that you just cut. You don't put it all over. Again, this is going to have adhesive. These actually stick really well to skin. You want to put it right around the hole you just cut. And I know you watched this on the ATI video, but this is just my reinforcement. It's okay if that paste gets on the stoma. It's not going to hurt anything. It's made for it. And the one on the video, when they cut the pouch, she cuts it a little bit too close. You really want 1/4 to an 1/8 to 1/4 of an inch between the edge of that wafer and the stoma. I think I told y'all in class they're very friable. They bleed really easily, so you don't want a bleeding stoma. Okay? And then troubleshooting, let's say you have a leak like the one I showed you in class. This is what powder's for. You can dust some powder on there, blot a little bit of skin prep wipe on there that most of your units in place are going to have. That'll help seal in that moisture, and you can get that pouch to stay. I think that's it for ostomies. I'm going to switch in a minute and we'll do some wound care, and you guys can talk to your lab instructor and see if you have any questions. And if you have questions, you can always send it to me. Thanks!